all graduates please be seated? Good evening. I am Dr. Mitzi Saunders and officiating this evening's ceremony. I extend a warm welcome to our graduates, family, friends, faculty, staff, and administrators. We have a few special guests in the audience as well. The president of the university, Dr. Donald Taylor and Mrs. Taylor. Our Dean of the College of Health Professions, Dr. Ahmad Radwan. And our Associate Dean and Chief Nurse Administrator, Dr. Saran Olier. Now for our invocation, I introduce Father Charles Oduke. Father, please approach the center podium. Father Oduke is Vice President for Mission Integration at the university.
Let us pray. Gracious God, with joy and gratitude, we thank you for the new nurses and healthcare professionals who we honor and celebrate at this pinning and transition ceremony. We thank you for their academic accomplishments, their parents, families, and friends, faculty and mentors, and all who have been part of their training and holistic formation journey. May they be faithful to the values of the Nurses' Pledge, modeled after the life and example of Florence Nightingale and the values of their Mercy Jesuit education. Bless the commitments they're about to undertake to be ethical in their professional conduct, respecting the dignity and worth of all their patients, dedicating themselves to compassionate care and service, treating each of their patients with kindness and respect. May they commit to be lifelong learners so that they can bring their research and scholarship to address the needs of patients, especially those from under-resourced and underserved communities. We pray for all of us here present tonight that we may enjoy each other's company and find comfort and inspiration in the words of our keynote speaker and the rich symbolism and the rituals of this transition ceremony. In your holy name we pray. Amen.
And now for opening remarks from our Associate Dean and Chief Nurse Administrator of the McAuley School of Nursing, Dr. Saran Olier.
Good evening. Good evening. That's right. It's a joyous occasion. To President Taylor, Mrs. Taylor, esteemed administrators, faculty, staff, family, friends, and most importantly, you, our graduates, welcome. Today we gather to celebrate a remarkable milestone in the lives and the culmination of your completion of your nursing program. This is a moment filled with pride, accomplishment, and the dawn of new beginnings. First and foremost, let's acknowledge your hard work and dedication and perseverance that have brought you to this point. Your commitment to excellence, the long hours of study, and your unwavering focus on your goal while also managing your personal lives are truly commendable. You have navigated the complexities of your nursing education with grace and determination, and you deserve the utmost respect and admiration from us. Nursing is a profession that is both challenging and rewarding. It requires not just knowledge and skill, but also compassion, empathy, and the strength to be a beacon of hope in times of vulnerability and need. Whether you are transitioning to the field as a new nurse or moving into advanced practice, you will encounter a myriad of experiences that will test your resolve, challenge your knowledge, and expand your understanding of healthcare. You are the frontline warriors in the battle against illness, the comforting hands in times of distress, and the guiding light for those in need. Your role will be pivotal in shaping the future of healthcare, influencing patient outcomes, and contributing to the overall well-being of communities. In your new roles, remember the importance of lifelong learning. The field of nursing is ever evolving. There are new technologies, treatments, and that are constantly emerging. Stay curious, stay informed. Never stop seeking to improve your practice. Embrace the opportunities for professional development and specialization that will come your way, and continue to grow both professionally and personally. As you embark on this new chapter, also remember the importance of self-care. Nursing can be emotionally and physically demanding. It's essential to take care of your own needs, so that you can continue to provide for others. Build a strong support network of colleagues, friends, and family who understand those challenges. And it's fortunate for you that you have started that network here with us at Detroit Mercy. To my esteemed faculty, thank you for your guidance and wisdom and unwavering support that you have not only imparted knowledge, but also instilled in our graduates the values of compassion, integrity, and excellence that are the hallmarks of our profession. To the families and friends of our graduates, your love and encouragement and sacrifices have been the bedrocks of these students' success. Today, you share in their achievement, and we also celebrate you. In closing, go forth with confidence, compassion, and courage. The journey ahead is bright, and the impact you will make is immeasurable. Congratulations, and thank you.
It is my pleasure to introduce tonight's keynote speaker, a remarkable leader, mentor, and advocate in the field of nursing and nurse anesthesiology, Miss Julie Stasek-Marks. Julie's journey in nursing began with a diploma from Toledo St. Vincent's School of Nursing in 1988. She is also an alumnus of the University of Detroit Mercy, earning her Bachelor of Science in Nursing in 1991 and Masters of Nurse Anesthesiology in 1997, where she was honored with the Wilma Krajcik Scholastic Award. In 1999, she incorporated Marks Anesthesia Services and has continued to provide high-quality anesthesia in a variety of ambulatory and office-based surgical suites. Beyond the 27 years at the head of the operating room table, Julie is the current federal political director for the Michigan Association of Nurse Anesthetists and visits federal legislatures in Washington, D.C., ensuring that the voice of nursing is heard on Capitol Hill. She also serves as a clinical preceptor for nurse anesthesia residents and lectures on advocacy and policy at Wayne State University. Julie has been published in Becker's ASC Review and C&G newspapers, writing about the future of anesthesia and the challenges we face in today's healthcare landscape. She is a remarkable example of the incredible paths a nursing degree can lead to. Please join me in welcoming today's keynote speaker, Ms. Julie Stasek-Marks.
Thank you so much. That's lovely. Oh, this is gorgeous. I'm so happy to be here. Thank you to University President Taylor, Dean Redwan, and Dean Ollier for inviting me to be here on this wonderful day for all of the new nurses that will be entering the profession and their families. Thank you for joining us. Today is more than a celebration. It is the mountaintop of your educational climb. Today is your summit. You have sacrificed time with family, financial stability, maybe your own health, and definitely your sanity. You have ascended into this pivotal profession that demands high-functioning skills, mental and physical strength, a little twisted humor, and a lot of heart. To the baccalaureate nurses, you are the first hand to hold, the calm in a storm, the tireless bedside advocates. Every patient you care for is someone's whole world. Always be present. To the nurse anesthesiologists, ours is a craft of precision in the middle of chaos. You carry your patients through their most vulnerable moments. Let your vigilance be matched with compassion. Because nursing isn't just in medication doses and gas concentrations. It is about establishing trust quickly with the patient and over time with the surgeon. CRNAs remember this. No matter what happens in the operating room, it is always anesthesia's fault. To the nurse practitioners and clinical nurse specialists, you will often be the first face and final word in someone's care. Never underestimate the power of listening. Diagnosis may begin in the textbook, but healing will begin in your conversation. So let's talk about the magnitude of this mountain called nursing. In Michigan, there's over 130,000 registered nurses, 13,000 APRNs, nurse midwives, nurse clinicians, and the nurse practitioners. There are 3,000 CRNAs. Nationally, there's over 5.2 million nurses, yet less than 3 hold a doctorate degree, proving that you are not only exceptional but rare. Consider this, in 1988, when I graduated, there was less than 3% male nurses. In my class of 132, there was 1 token male. I am very honored he is here tonight as my husband of 34 years and my fellow CRNA. Today, male nurses have surged to 13% of that 5.2 million, 500,000 male nurses. Nursing is evolving, and you men are part of that transformation. In Michigan, the canvas of healthcare is vast, and I do hope that you choose to stay in our wonderful state. And the knowledge that you have gained here at the University of Detroit, I want for me, selfishly, when I am old and in need of nursing care. There are so many employment trails as you navigate your nursing journey. Michigan has over 371 hospitals and ambulatory surgery centers. There are 63 critical access hospitals that are serving the vast rural communities. We need you in Michigan. In Oakland County, there are 9 major hospital systems. Detroit has 10. Between Ann Arbor and Lansing, there's 9. And all the way in Grand Rapids, there are 13. The west side of our state is just exploding with opportunity. But nurses are still needed in dialysis centers, elder care facilities, in mental health and in rehab centers. Even insurance companies, IT programs, and sales are hiring nurses. Don't forget, you can be a phenomenal nurse educator, like here, sitting with us and who have seen you through your last 3 years, and you can mentor the next nursing professionals. My own success with nursing can be directly tied to the education and support from the University of Detroit Nurse Anesthesiology Program. Specifically, Dr. Michael Dosch, Dr. Andrea Title, and Petra Herr. They went above and beyond clinical practice. They sat on the boards of directors at their state association and nationally. They were published authors. They instilled in me the necessity of advocating for your profession in order for it to succeed. They demonstrated that giving back is the only way to keep moving forward. Leadership was imprinted in me at the University of Detroit Mercy, and I see some real potential sitting out here. Will you step up and lean in? Now, I realize your entire educational climb was complicated by the avalanche called COVID. COVID brought to the forefront the significant impact that nurses have on our nation's recovery and survival. I applaud your jumping in with both feet to this profession. Now, shows like ER, In the Pit, they glamorize and sensationalize nursing, and it's really kind of fun to watch because you're going to notice they just put the IV in upside down, or the patient's talking around the breathing tube. Everybody else in your family won't pick up on it, but you will. I am very excited at many trends that I see in nursing these days, not just AI, that scares me a little bit, but these also stood out to me. There is a concept called work-life balance. Thank you, Gen Z. You, have prioritized downtime, family time, less overtime. I really need a drink of water. I'm kind of struggling here a little bit, sorry. Thank you. I love all of this focus, but you know what? Nursing is a 24/7 job. Who's going to do the overtime? Who's going to do the night shift? Who's going to pick up the call? Us baby boomers, we are tapping out. This is going to be your biggest solution to find. I see wages continually increasing. The sign-on bonuses are unreal. I am watching nurses fill C-suite positions in the hospitals, CEOs, CFOs, and they're taking political seats in Lansing and in Washington. I just spent a week in Washington meeting all the Michigan legislators. I do that every year. And this year, in the House of Representatives, we have 3 nurses. They are advocating for our profession. They are writing bills and making sure rules are protecting us and the patients. Can you do that? I know you can. The critical workload issues that we faced are now being addressed by nursing unions and laws that are looking out for patient safety and nurses' safety. And the workplace culture is no longer tolerating incivility. I see peer support groups, employee assistance programs, and debriefing protocols, all building a healthy workplace culture. Finally, we're treating each other with grace instead of eating our young. Wellness is on the forefront of society and in nursing. It is essential that you personally find and build healthy coping mechanisms, whether it's yoga, walking your dog, running, shooting hoops, or cold plunges. You need to every day find a way to release those happy, healthy endorphins. Do not shut down, avoid doom scrolling, and don't hide behind alcohol. There is one truth in nursing. Besides, it's always anesthesia's fault. The other truth in nursing is not if, but when a critical adverse event will strike. And it may happen more than once in your career. Remember this, it's okay not to be okay. Take the time to heal. Nursing is a team sport. You will work alongside different educationally prepared nurses, ancillary staff from different cultures. You need to get to make those relationships and know the staff you're working with. Because I'm telling you what, environmental services is going to notice Mr. Jones is crawling out of bed before you're done getting morning report. Foster these relationships. This is your key to success. You will be the lead at the head of the bed in the OR. You will be the lead on the floor or the clinic that you're managing. Now let's get back to the mountain before the sun sets. As you descend from this graduation peak and you begin the trek down into real practice, real responsibility, and real lives, remember that the University of Detroit Mercy has provided you the skills and the tools to succeed. Carry these in your little fanny pack that we all wear again. Pull them out when faced with a difficult conversation with a family or a physician. Know your worth and remember your training here at U of D. Carry your knowledge boldly. Never stop learning and advocating. Lead with confidence, but never lose humility. Go forward, graduates, not just with degrees, but with purpose. Congratulations, and welcome to the most rewarding and trusted profession in the world. I am honored to call you all colleagues. Thank you.
We will now move forward with the hooding of our Doctor of Nursing Practice and Doctor of Nursing Practice and Nurse Anesthesia recipients. Will the graduates and faculty please take your spots and begin when ready?
Raymond Smith, project initiating a formal simulation program for immersion into nurse anesthesia clinical education, a quality improvement project. Chair, Dr. Joshua Olson. Kevin Jackson, project implementation of a risk assessment tool for predicting postoperative cognitive dysfunction in elderly surgical patients. Chair, Dr. Greg Bozomowski. Rachel Boyne, project administration of transversus abdominis plane blocks by certified registered nurse anesthetist for pain management in obstetric and gynecologic patients, a quality improvement initiative. Chair, Dr. Greg Bozomowski. Maria McAuley, Project Administration of Transversus Abdominis Plain Blocks by Certified Registered Nurse Anesthetist for Pain Management in Obstetric and Gynecologic Patients, a Quality Improvement Initiative. Chair, Dr. Greg Bosmowski. Sydney Hill. Project Implementation of an Ultrasound-Guided Technique for Difficult Subarachnoid Blocks, a Quality Improvement Project. Chair, Dr. Greg Bosmowski. Isabel Miller. Project Implementation of an Ultrasound-Guided Technique for Difficult Subarachnoid Blocks, a Quality Improvement Project. Chair, Dr. Greg Bosmowski. Callie Henry. Project Implementation of an Ultrasound-Guided Technique for Difficult Subarachnoid Blocks, a Quality Improvement Project. Chair, Dr. Greg Bosmowski. Fava Thomas. Project Implementation of Support Systems for CRNAs who experience Second Victim Syndrome. Chair, Dr. Arthur Coe. Christopher Alietta. Project Introducing Gastric Ultrasound in Anesthesia Practice in an Urban Medical Center, a Quality Improvement Initiative. Chair, Dr. Joshua Olson. Kevin Pasquale. Project Implementation of Support Systems for CRNAs who experience Second Victim Syndrome. Chair, Dr. Arthur Coe. Brittany Thompson. Project Implementation of Support Systems for CRNAs who experience Second Victim Syndrome. Chair by Dr. Arthur Coe. Anthony Croft. Project Implementation of a Risk Assessment Tool for Predicting Postoperative Cognitive Dysfunction in Elderly Surgical Patients. Chair, Dr. Greg Bosmowski. Ten Xiaoping. Project Enhancing Perioperative Management of Coagulopathy through Thromboelastography, a CRNA-driven initiative. Chaired by Dr. Joshua Olson. Melinda Savaya. Project Administration of Transversus Abdominis Plain Blocks by Certified Registered Nurse Anesthetist for Pain Management in Obstetric and Gynecologic Patients, a Quality Improvement Initiative. Chair, Dr. Greg Bosmowski. Enji Abu-Nassar. Project Implementation of a Risk Assessment Tool for Predicting Postoperative Cognitive Dysfunction in Elderly Surgical Patients. Chair, Dr. Greg Bosmowski. Rizan Habash. Project Enhancing Perioperative Management of Coagulopathy through Thromboelastography, a CRNA-driven initiative. Chair, Dr. Joshua Olson. Madison Champanella. Project Introducing Gastric Ultrasound in Anesthesia Practice in an Urban Medical Center, a Quality Improvement Initiative. Chair, Dr. Joshua Olson. Hannah Beach. Project Introducing Gastric Ultrasound in Anesthesia Practice in an Urban Medical Center, a quality improvement initiative. Chair Dr. Joshua Olson. Sean Mosley. Project Enhancing Perioperative Management of Coagulopathy through Thromboelastography, a CRNA-driven initiative. Chair Dr. Joshua Olson. Luke Corder. Project Initiating a Formal Simulation Program for Immersion into Nurse Anesthesia Clinical Education, a Quality Improvement Project. Chair Dr. Joshua Olson. Kendall Owens. Project Perception of DEI in the University of Detroit Mercy's Nurse Anesthesia Program, a student-based evaluation. Chair Dr. Morgan McArdle. Alexandria Harrison. Project, a program evaluation of the Mobile Integrated Health Chair. Integrated Health. Chair Dr. Karen Mahalik. Melissa Hanna. Project Implementation of a Peer Chart Audit Tool within a research department, a program evaluation. Chair Dr. Karen Mahalik. Brandon Tater. Project, a program evaluation of a nursing leadership-driven clinical debriefing structure. Chair Dr. Karen Mahalik. Darcy Guidus. Project, Breast and Cervical Cancer Screening in Sexual Minority Women. Chair Dr. Mary Surowski. Brianna Harkovich. Project, a needs assessment to improve the pediatric experience and increase the pediatric population at East Area Family Practice. Chair Dr. Teresa Wyatt. Iman Ali. Project, culturally competent advanced care planning for Arab American patients and families. Chair Dr. Renee Courtney. Hannah Al-Kidi. Project, Bridging the Gap, Enhancing Dementia Diagnosis Through Translated Tools and Streamlined Surgical Assessments. Chair Dr. Renee Courtney. Khalud Alastri. Project, Implementation of a Peripartum Depression Program in the Obstetric Setting for Arab American Pregnant Mothers. Chair Dr. Arthur Coe. Shorman Akhtar. Project Implementing a Perinatal Depression Program in Primary Care for Minority Women. Chair Dr. Arthur Koh.
We will now move forward with recognition, pinning, and white coating of graduate recipients in our 4 master's degree programs and 2 postgraduate certificate programs. Will the faculty and students involved please take your spots? We will begin with the Nursing and Healthcare Leadership Program recipients and faculty. I now call the Adult Gerontology Clinical Nurse Specialist online program recipients and associated faculty forward.
We have Laura Dolman. Temi Topi Olwale Bryan. Thera Riggins.
I now call the Adult Gerontology Clinical Nurse Specialist Postgraduate Certificate online program recipients. None? Okay. And now our Family Nurse Practitioner Program recipients and associated faculty.
Alan Yassin. Reneen Sala. Shreen Marini. Aisha Gabar. Lisa Fillion, Lillian Carlisle, Abir Almachi, Ehsan Karimi, Abdullah Shirazi, Donetta Hartley, Cody Oberly Ball, Samantha Nemanitis, Sherry Malinzak, Dalton Deagle, Summer Calihan, Marie Soleil Sauka,
And finally, our Master's Entry Advanced Generalist Nursing Program recipients and associated faculty.
Kira Hamilton. Elise Holt Briggs. Kaylin Hairston. Courtney Sykes. Danielle May. Ireland Bone. Jessica Sinani. Ashley Hall. Tracy Hossain. Harminder Kaur. Paige Spitznagel. Nicole Scaglio. Erin Sherody. Allie Johnson. Demaya Mason. Rebecca Palmer. Maya Hamden. Lauren Harb. Zainab El Ghazi. Jessica Furtado. Daniela Collage. Amanda Essek. Jessica Taylor. Michaela Terry. Skyana Fullen. Kaylin Fife. Talia Thayed. Molly Nicholson. Hallie Hunt. Hattie Parrish.
Hey, how about a final round of applause for our doctoral, master's, and postgraduate certificate recipients? We will now move forward with the recognition and pinning of our Bachelor of Science in Nursing recipients from our RN to BSN completion program, second degree option program, and our traditional full and part-time programs. Will the faculty and students involved please take your spots? We will begin with the RN to BSN completion program recipients and associated faculty.
Julie Harville. Taylor Ryan. Amanda Wallace. Latoya Miller.
Fatima Nasser. Parnadeep Toma. Parnadeep Toma. Rita Toma. Shania George. Jasmine Dumitru. Nicholas Dumitru. Rachel Molnar. Yasmin Farhat. Julia Fortino.
Is this 5?
Clara Alcori. Olivia Zalewski. Marissa Silver. Erica Tupin. Bailey Thomas. Elena Jovanovsky. Navleen Kaur Gill. Ayanima Kalam. Chelsea Ina. Olivia Westfall. Josephine Vulai. Grace Acho. Jenna Hurley. Victoria Bartholomew. Joanna Alexander. Brooke Budd. Zachary Holman. Evangelia Pispedicus. Morgan Giordano. Faith Kaskorkis. Grace Kowalski. Ayet Abdullah. Afnan Amro. Lillian Dobson. Ria Ahmed. Marcy Alicia. Natalie Fiore. Bianca Isho. Marissa Clark. Gianna Di Stefano. Samantha Thomas. Isabel Mansour. Grace Soroki. Chloe Steenberg. Madison Oki. Adriana Miraz. Derek Brown. Matthew Newton. Elena Frazier. Kayla Rice. Yasmin Merhi. Angela Martinez Cantera. Hyun Julie. Logan Forsyth. Tina Elwert. Gabrielle Fisher. Jason Pineni. Christy Galligan. Sharon DeLeon. Sina Ali. Lena Ahmed. Malak Zarik.
How about a final round of applause for our Bachelor of Science in Nursing recipients? And now we will have a blessing of the hands of all graduates. I welcome Sister Helen Marie Burns to the podium to perform the blessing of the hands. Sister Burns is a current Board of Trustees member and Mercy Sponsor affiliate for the Office of Mission Integration. Will all graduates please stand and remain standing afterwards? Sister.
Thank you. So the pins and the coats have been distributed and the hoods have been awarded. So I'd ask our recipients of the bachelor's, the master's, the doctorate degree in nursing to just pause, take a deep breath, and consider the vocation to which you have been dedicated. You have already indicated you're going to dedicate your life, and the profound nature of the work to which you are committed. So hold your hands before you and look upon them and reflect that these hands are indeed one of your finest tools for healing. These hands will touch with gentleness, they will support with firmness, they will guide, they will diagnose. They are precious, and they will express mercy and compassion, or they will not, depending on how you touch in your healing profession. So all of us gathered ask, blessed be these hands that will touch life. Blessed be these hands that will touch pain. Blessed be these hands that will embrace compassion. Blessed be these hands that will draw blood and administer medicine. Blessed be these hands, for they will comfort the dying and they will hold the dead. Blessed be these hands as we hold the future in these hands. Bless, God, be all our hands, for they are the work of your hand, O Holy One. Amen.
I now introduce and welcome Dr. Gregory Bazamowski to recite the Florence Nightingale Pledge along with our graduates. I invite all graduates to follow along in their programs and recite the pledge along with Dr. Bazamowski.
I would also invite all the other nurses and nursing faculty to follow along. The pledge is something that we should keep in our hearts all the time. So please follow along. I will strive with all my being and with the help of God to continue to become an open, kind, honest, and diversified individual. In doing so, I will attain the qualities essential in the practice of nursing, for it is only after realizing one's self-worth we are able to promote that of others. Deliverance of high-quality health care is of essential importance, but let us also reach beyond a treatment of diagnosis and remember that entrusted to my care is a human being with all the loves, hates, fears, and idiosyncrasies that are an integral part of the human species. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and family affairs coming to my knowledge in the practice of my calling. Let me not grow too comfortable in my knowledge, but actively seek out information for continuance of my education. Being a nurse requires continuous growth. I dedicate myself to this cause and my life to the profession of nursing.
You may be seated. And finally, I welcome the Dean of the College of Health Professions, Dr. Ahmad Radwan, to deliver our closing remarks.
Good evening, everyone. Congratulations, you made it, right? What a joy it is to stand before you today, surrounded by hope, talent, and great sense of pride. To our remarkable nursing graduates, from the bottom of my heart, congratulations. Today is not just a ceremony, it's commissioning, a calling answered, and a sacred transition. As your dean, I am deeply honored to witness the compassion that you've cultivated through the years of study. I am equally honored to witness the sacrifices that your families and beloved one, as well as your beloved faculty and staff members who have supported you along the way today. To the family and the support network, your love and support have carried these students to this finish line. Thank you very much for what you have done. Please allow me to thank the organizing committee of this event. You can't imagine how tiring of a process it is to organize such a wonderful event. So thank you very much for the organizing committee and to our officiate tonight. We gather today in a world that aches, a world that is frankly in pain, where conflict rage, refugees flee, disease, injustice, and fear often headline our days. And yet, you are becoming nurses, and you are choosing to enter this world not with despair, but with healing. You are answering the cry of the vulnerable with action. This is, in fact, an act of mercy. Catherine McAuley, our spiritual founder, believed in walking straight into the suffering of the world with courage, tenderness, and practicality. She once said, "The poor need help today, not next week." And today, each of you becomes that help. You become Catherine's hand and heart, restoring dignity, listening deeply, and bringing peace where chaos threatens. While doing that, I encourage you to take good care of yourselves. Nursing burnout is a real thing, and we want you to continue in the field of nursing. So please take care of yourself. And I encourage you, instead of burning out, to please protect that flame of knowledge and hope inside you, and let us use the term burn in instead of burning out. Do not forget to laugh. Your laugh will help you along the way. So let us try to laugh in the coming 2 minutes together. I'm gonna take you to a 45-year journey that starts today and ends with your retirement. I will not be there at that time, but I wish you all the best. Out of those 45 years, assuming that you will sleep 8 hours a day, you will spend 15 years sleeping, and you will spend 15 years having fun and enjoying life, That includes transportation, includes travel, includes the time you spend arguing with your parents when they ask you to clean your room. And later in life includes the time you will spend arguing with your children when you ask them to clean the room. That leaves 15 years only for work. And I'm coming from the back end to tell you 15 years are not enough to achieve all of your goals. But for sure, they are adequate enough for you to leave a positive impact. My advice for you is 4 letters, P, P, H, and H. I encourage you to find or to continue to find your passion. That's the first P. And I'm sure you did find your passion. And then you have to be persistent in achieving your goal. And I would love that persistence to be tailored towards continuing your education. The first H is to be humble. Remember, it's only 15 years, so you shouldn't be arrogant at all. The last H is for hope. When you're done with your journey, and when you pay your debt, and when it is time for you to start making real money, I encourage you to be the reason of installing hope to the new generation of students, perhaps by donating to a scholarship that they would benefit from. I would love to see you back to UD Mercy to earn your master's or doctorate. And for the doctorates today, I encourage you to return to us as faculty and colleagues. As you go forward, please know that you are not alone in this journey. You carry your families with you. You carry your faculty with you. You carry your faith with you. And you carry centuries-old mission of mercy with you. We will continue to support you along the way. So my final message is, please go. Heal the world. Make it a better place. Please advocate. Please lead. And when the road is hard, and it will be, please remember that your work is holy and you were made for it. Graduates, I am very proud of you. I look forward to seeing you tomorrow at this stage again. I wish you all the best. God bless you. Assalamu alaikum.
Thank you, Dean Radwan. This concludes our ceremony. Will all guests remain seated for the graduate recessional and then followed by faculty? Thank you, congratulations, and have a wonderful evening celebrating with family and friends.